desperate. Their current funding only allows them to accommodate 16%, I said 16% of the identified need, and that means that 84 out of every 100 children in York Region needing mental health services are going without. 84 out of 100 families being torn apart with no help in sight, Minister. When will this government give children's mental health in York Region the support that you have the responsibility to deliver?
Good question.
Thank you very much, Speaker, and I'm very pleased to have an opportunity because I too was in York Region last week and visited the York Centre for Children, Youth and Families, who are doing incredible work on the ground in community, serving children who need that help and attention. And Speaker, I am so proud to be part of a government that provided the first base funding increase in over a decade in 2004-2005 and another $24.5 million in 2007-2008. We've invested an additional $64 million in support to expand mental health services for children and youth, an increase of 20%. Speaker, is there more to do? Of course there is, but good work is being done in communities across the province. I've been talking to those groups about how we can better improve the services that they're providing in communities. It is something that we are very much focused our attention on. Thank you very much, Speaker.
Well, the minister is certainly right. They are doing good health and they're doing good work, and in spite of you. In York Region, Children's Mental Health Ontario has taken on the arduous task of child mental health support. Yet York Region only receives, here are the numbers, $127 per child, while the rest of the GTA gets $221 per child. Wow. The people of York Region are tired of being treated like poor cousins of the GTA by this Liberal government on this file and many other files. Minister, will you commit today to fully funding the mandate of Children's Mental Health Ontario, yes or no?
I've heard some echoes in the House about where these questions are coming from, and I agree very much that this is quite rich coming from the other side. And I point to the Auditor General's report in 2002. Since 1992, there have been no increases in base funding provided to community mental health agencies for programs that were operated at that time. One district council noted that it has forced community mental health agencies to reduce services. Speaker, the good work that's being done in communities across the province is in partnership with our ministry. We continue to work on these critically important issues and expand services for communities. I've met on many occasions with Children's Mental Health Ontario, learning about the innovative solutions that are being developed across the province. Yes, there's more work to do, Speaker, but for the first time in many years, they have a government that is committed to doing this work in partnership with them.
Thank you. New question, Leader of the Third Party.
Well, Speaker, perhaps not surprisingly, my question is also for the Minister of Children and Youth Services. A government study concludes that Hamilton and Niagara families face the highest wait times in Ontario